Hi everybody, Simon Whiteley here. Welcome to my latest video. This is essentially a walkthrough of a high-level stamp control structure model of the response to the COVID-19 coronavirus. What I'm going to do is I'm going to walk through it, talk about some interesting observations. I'd love to hear what you think about it, so please comment below. If you like this video, please remember to like, share and subscribe. And of course, thanks very much for watching. So what I want to sort of highlight here is essentially it's a high-level control structure model basically made up off the top of my head based on the information I'm aware of. I'm not an expert in this domain whatsoever, so of course things will be missing, but this is just to highlight two things. The first is that the power of using a control structure to visualize the problem and understand where some of the challenges might be, but the second is that it's very rapid, very straightforward. So the first thing is to think about the control processes. So in this case, we're talking about patient care, either in one specific area or in general, but then also the public health. So the general public, their health, and then how they either end up being patients or how they infect people that then become patients. So ultimately, it's this physical process at the bottom that we're trying to deal with, we're trying to control for safety reasons. And of course the medical team and then medical team N+1, they are looking after patients. They have a control algorithm and mental model related to how they look after the patients. Clearly with an unknown virus, this will be lacking to start with, and over time that'll develop and get more advanced. And clearly the information about how they treat patients and information about the virus is essential. Now there are two ways that I understand that information can be provided and cause updates here in their behaviour, and that can come from the medical coordination sort of high level component or controller in the structure. So healthcare management, they provide information about what treatment is necessary, what resources are necessary, and then that can happen. Now of course, how this medical coordination entity is updated with information may come from the government, from some society coordination, or from other medical teams, and that could be provided directly or up into the medical coordination component. And clearly the control algorithm of that entity is critical in making sure appropriate resources are made available so that this control can be performed appropriately. Then of course I've added here context associated with the facility that this care is taking place in. So the facility itself, the algorithm of the facility managers and what that facility looks like, how it's configured, needs to be changed specific for this type of situation. So sort of going out again, looking sort of overview then. So medical coordination, looking after patients, but we have to also deal with and manage the general public and how they behave. So their control algorithm, how do we update that? Well, clearly the medical coordination entity will be seeing what's going on in the front line. They will be aware of the facilities they've got and the limitations they've got. And that information will need to be flowed up into the government society coordination controller at the top. So the control algorithm of that will need to be updated so that they can issue appropriate control actions over here in the context of the general public. So this could be your self-isolation, stay-at-home control action, and then in the context of the police service, so they will issue control actions to the general public as well. And then of course there's the media here that will talk with the government, receive information about these issues and coordinate it, communicate it to the general public. But then of course you've got the coordination with the medical coordination controller, so providing information to the media. And then of course, in terms of the medical coordination here at the front line, what aspects does the medical coordination have with the general population, the general public? Is this control loop here actually present so that the medical coordination, in terms of their management, their mental model and their control algorithm, do they have sufficient information about the state of the general public that they can use to then change their strategy as to how they do the medical care, facilities control, and also coordination with other medical teams? So really, in terms of the safety of patients, it's all about this part of the control structure. But then when we're talking about preventing more patients and making sure the general public are aware of how serious this is and what changes that should have to their behaviour, there should be a link between those two, and it's either directly or indirectly through the media, or perhaps even up through the government control structure and then back down either directly through the police or through the media. Now clearly this route up here from the front line up through the government back down the other side, that's actually quite a long sort of delay in terms of reactions. So you issue the control action, there is a delay in that issuance and it's in action, and then also in terms of feedback. So to improve the safety down here, the response down here, the medical coordination mental model control algorithm really needs more rapid feedback from what's going on in the general population. And you could argue that that will be from the tests that need to happen so that they can appropriately change their actions, the way that they're working, but also in terms of the medical teams. So do they have real up-to-date information about how to deal with this and what they need to do? And if they come up with some better ways of dealing with this, diagnosing it and dealing with it, then how does that information get coordinated to other medical teams and also to the general public? Because you might argue that enforcing a stop-at-home order and then using the police to enforce it, that's actually destroying the goodwill of a lot of the general public. And if the general public's mental model is that this is just the flu, then they're less likely to comply with these orders, which will make this much, much worse over here. Now, clearly, the information about the virus is coming up through the medical coordination via the government and back down, or through the media. And the media are not necessarily in this for public safety; they're more in this for making money. So they like to sensationalize things, which can cause the mental model and algorithm of the general public to be not necessarily what's right for public safety, and will affect their behaviour and potentially cause more problems over here. So there's a couple of suggestions there really. Let's get the medical coordination directly with the public in some shape or form through social media or however that's done. But again, from a loop delay perspective, if it's from the medical front line down through the management to the general public, what about coordinating directly with the medical team? Perhaps have the medical teams showing videos and interviews associated with what's going on down here and why it's so important that the general public isolate, stay at home and don't go sunbathing or whatever it is. Now, essentially all I've done there is a very, very sort of quick video just to sort of go through the control structure. I'm sure you can tell I could probably talk about this for many hours, because just this simple model can allow you to ask very powerful questions and spot opportunities for improvements or changes. Now, of course, I'm happy to talk about this. I'd love to know what you think, so please comment below, let me know. And of course, if you like this video, please remember to like, share and subscribe to my YouTube channel. Thank you very much for watching, and I'll see you in the next video.